Hey, Dr. Joe Singh here with Meridian Health Center. Did you know that headaches are very common, but they're not normal? Yes, I said that correctly. They are not normal. One of the biggest things that we see in our office when I do a consultation with a patient who is suffering from headaches, they think that their headache is a normal part of their life. When I ask them how many headaches do they get a week or a month, sometimes it's between 1 to 2 weeks, 5 to 6 a month. And I look at them, I go, do you realize that is not normal? And they'll always say, well, that's normal to me. I've had those for X amount of period of time. Yes, it might have been common for you and common for other people, but again, that is not normal. That's not how the body functions. Those are warning signs there is something going on and we got to find the root cause of that. So when we start looking at headaches and where they're coming from, one of the most common areas where we see headaches start from is from the neck area due to things called subluxations. And subluxations are misalignments of bones that are misplaced, putting pressure on the spinal cord or the nerve, or maybe even postural distortions where they're putting stress on the spinal cord, stress on the blood vessels going to the brain, decreasing oxygen, blood flow, and so forth to the brain, creating inflammation, causing pain, such as a headache. So one of the things we do here in our office is we assess to see exactly what's going on. How we do that first is we take a complete history consultation, examination, orthopedic tests, any neurological tests if needed to determine exactly where your headaches are at, where they're coming from, and so forth. From there, we'll go and take x-rays because x-rays is going to tell us exactly where those subluxations are at, how long they've been there, are they causing your headache, and if so, can we fix them? 99.9% of the time when we see patients with headaches, we see it coming from the neck. We help so many people with headaches because a lot of people don't realize it's coming from the neck. Most of the time when people suffer from headaches, it starts with neck pain before it becomes a headache. And so when we look at the neck, we have to determine how are the bones properly aligned. So just like a normal heart rate, just like normal oxygen, you should have normal curves in your spine. So when we look at a spine, we want to have normal C-shaped bend. We want to make sure that each one of these bones are moving properly, that these nerves coming out are communicating. Because of poor posture, stress, trauma, life, accumulation of time, throughout time our body begins to shift forward, stretching the spinal cord, putting pressure on the nerves, putting our skull in extension, putting pressure at the brainstem, causing these headaches to come out throughout time. If we don't address these issues, they're just going to stay there. We're going to mask them with other things such as over-the-counter medications or maybe prescriptions, maybe it's stretching. And those things may help get rid of the pain temporarily, but we got to get to the root cause of it. And most of the time it's coming from your neck. So if you haven't had your spine looked at or x-ray, determine exactly where those headaches are coming from, it's a great opportunity to do so. Give us a call with that. But once we determine what's happening with the patient, then we bring them into an adjusting room and we start to get those bones moving and putting them in the right position so that their body can start to function and heal. So we're going to show you a demonstration of what it looks like to adjust the patient. We have several different types of adjustments. Some are very soft, some are more manual that you would see in a chiropractic office. And then we're going to show you some therapies also of what that looks like after the adjustment to help hold the adjustment and get the vertebra in place so we take the pressure off the nerve and that body can communicate. Therefore, we'll start to reduce the headache or the neck pain. So let's show you what that looks like. So when doing an adjustment on a headache, obviously we want to take our consultation and history to determine exactly where these headaches are coming from. And right now we're just going to show you what a couple adjustments look like on a patient. We have very low force type adjusting tools such as activators, which are very good to help with headaches. Once we assess what's going on, a simple technique is applying to where the vertebra is out. And what this tool does, it applies a small spring-loaded force into the vertebra to realign the vertebra, get the vertebra moving to begin to start taking the pressure off of that spinal cord and nerve that's causing that headache. A second way to also adjust if it needs a little bit more force is through an arthrostim. An arthrostim is very similar to our activator, but it also helps get the vertebra moving just with a little bit more force. For example, if we're wanting to get more motion in the lower cervical spine, we can see how that starts to apply force there. Go ahead and roll over on your back for me. With Shanna, Shanna has, she's been having constant headaches for her whole entire life until she started getting chiropractic care, and it minimized her headaches to almost a couple a year. And but when she does get them, we know exactly where they're coming from, and in her case, it's in her upper cervical spine, which is where we see most issues. And how we address that through a chiropractic adjustment is a very easy manual adjustment where we're addressing the atlas and where it's subluxated, and when we take that force, we just nice little thrust to get that bone moving back in position. And then one on this side as well. And there we go. So that's what an adjustment looks like when we address headaches.